for anyone out there who's ever had chronic ear conditions, you're going to relate to this one. Since I was born, really, I've had, earaches, had to get my ears syringed, chronic infections. So my whole life has been like that. And as an adult, had a lot of pain here, ache and discomfort. And coMra has been my go-to since we started back in 2009. Before that, I just had to live with it. And anyone who's had chronic ear condition, you get that pain deep inside the head and down the neck.
It's not like this is happening all the time. It comes up periodically. It could be months without it happening, and it could happen a few times in a week. Depends on stress levels, physical exhaustion, all kinds of different factors.
Okay, and I've lived with that. And now what I do, I just simply turn on my coMra. Okay, I treat over the ear. I set it for 5 hertz, 10 minutes, turn it on. I do 5 minutes on the ear. Then I flip up the earlobe. You'll see it right there. So I flip up the earlobe, put it behind the earlobe, do 5 minutes right there, and that's it. And I cannot tell you what a godsend that is. And anyone with ear issues, you'll understand. I don't necessarily feel it go away right then. I just carry on because that's what you do, you just carry on. But then what happens is, I don't know when it stopped, but about 15, 20 minutes later when I check in with myself, or maybe sooner, I'll be like, it doesn't hurt. I'm not getting that ache, whether it's in the eustachian tube, the eardrum, wherever it is for people. Like I said, I just apply coMra. Sometimes, if it's really bad, I'll do 10 minutes and 10 minutes. But most of the times, I set it to 10, do around 5 minutes over the ear, 5 minutes under the ear between this big bone right here and your jaw, okay? Soft tissue, treat right there, and it's done. So thank you, coMra Therapy. Thank you.